Hi guys.
Hi.
Hey, how are you?
Hi. Very good. How are you?
Good, thank you. Good.
Good, good. We
Ha-
started on time, so that's a good
I
thing.
know,
Like it's
it's
almost
great.
yeah.
We're already doing well.
my name's Dr. Shah. This is Dr. Lingamanaicker, and we are both from Beautox, a medical aesthetics clinic in St John's Wood, London, in the UK.
I think it is a great topic, especially for people with skin of color, especially the Asian skin, because I think pigmentation is one of the thing which is kind of not properly defined when it comes to our skin, and usually people mistake it with like if they have skin tanning, they think, oh, I think it is skin pigmentation, it will just go off, maybe I'll just apply something like a homemade mask or a DIY. But that is absolutely wrong, because DIYs don't work for pigmentation. So I do get a lot of these questions, and that is, I think, something that triggered me to do this talk, because I wanted to educate them that pigmentation is it requires a different treatment, it requires a different management, it doesn't go out with DIYs, right?
Absolutely, yeah. Um, and the most important thing to emphasize is just, see a specialist, a medical professional early in the treatment of it to kind of get it
Yeah,
under control
absolutely.
and get
Abs-
precise treatment plan.
Yeah.
yeah,
It's also,
absolutely, I agree.
it's definitely tricky as well, like you said, with our skin or any skin of color, I think, because once you start going into the slightly darker skin types, it is a whole different ball game in terms of treating, and you have to be so much more careful with the kind of therapies. So that's why it's vitally important you actually see someone who knows, like a dermatologist, someone who actually knows what the best thing to do is for your skin, so you don't make it worse, which is the main thing.
Absolutely, absolutely. My first question is, how do you define
Yeah.
pigmentation? Because a lot of people do mistake it with other skin issues, like first of all, like I mentioned, tanning. So how do you define it properly?
So, should I answer this one? So, hyperpigmentation basically is an umbrella term, and we're talking about hyper, which is excess pigmentation. So, like as you said, compared to tanning, we're not talking about your entire skin changing color. We're talking about patches of your skin showing excess pigmentation. And this can be anywhere on your body, it can be on your face, your back, your hands, but basically it is a huge umbrella term, like you said, and it covers lots of different pigmentation disorders, and it's got various causes. I think the main important thing to note is that we do need to, if you're treating hyperpigmentation, the important thing is getting the right diagnosis, and once we have that, we can treat the cause of the hyperpigmentation. So like you correctly said, one cause of hyperpigmentation is post-inflammatory hyperpigmentation. That's caused as an inflammation reaction to conditions like acne, psoriasis, eczema. So, once you exactly know what you're treating, you can go down the correct treatment pathway, because in that case, if it's PIH we're treating, we need to get onto the cause of it, which would be treating that acne, treating that eczema. But that is essentially the definition of what hyperpigmentation is.
Okay, okay. So can you just briefly talk about the different causes of face pigmentation?
Yeah, so we've covered one, which is post-inflammatory hyperpigmentation, and then that's one of the biggest causes. And then another big cause is something we call melasma, and melasma is essentially a condition caused by a number of factors. So that might be UV exposure, sunlight, sun damage, hormones. A large component of that is genetics as well. And what melasma is basically you get these patches of pigmentation, typically on the forehead, the cheeks, on both sides, just above the lip. And it can be sort of quite a superficial, melasma can be superficial, so it sort of affects the first layer of the skin called the epidermis, or it can be much deeper, where it affects the dermis, or it can be a mixture of both. And sometimes it's difficult to tell where it is. So those are the 4 types of melasma we can get. And melasma is something that's very common amongst skin of color, and can be very difficult to treat as well. Another part of melasma is melasma, particularly in pregnancy, which we called cloasma. And cloasma essentially is, again, some people may only see their melasma during their pregnancy, and it can be quite distressing. Your body's going through a number of changes, and on top of that you get skin pigmentation, but our main advice is to just, do conservative management whilst you're experiencing it, because not many therapies, especially the harsh ones, can be undertaken during pregnancy. But then it sometimes does spontaneously resolve within the first year. So that's melasma that we've covered. We've covered a bit on post-inflammatory hyperpigmentation, where, like we said, it can be due to acne, psoriasis, any sort of irritation, sun damage. Another big cause is, some people have birthmarks, which can lead to hyperpigmentation. And then there might be sort of causes that we, as medical professionals, or some things are caused by taking excess medications, or as a result of lasers or something like that as well. So anything inflicted upon by following a treatment is also a cause of hyperpigmentation. And then finally, some of the biggest things is you get sunspots as well, which, and lentigines, and those are very discreet. So you get sort of almost larger freckle-like spots on your skin, which is very different to the way melasma presents. So I think in all of this, the takeaway message is that you have to diagnose the cause of hyperpigmentation very correctly in order to treat it properly.
I think you're absolutely right. Like, sun is one of the major factors, and a lot of people don't talk about it, or they don't know about it. And secondly, as you mentioned, post any therapy like lasers, I have seen in my practice a lot of people who underwent microneedling and it wasn't done properly, or post peel if they didn't take proper skin care. Yeah, skin trauma. So that was also one of the major causes for developing pigmentation. So my third question is, what can a person do? Like, if somebody thinks that they have a skin which is more prone to pigmentation, what would be the prevention that they should do? Just talking about the prevention right now.
Just the prevention, okay. So, I think we all know I think understanding prevention comes back to the causes, which we just discussed. So, genetics, hormones, all of these things we talked about. The important thing is there's some stuff that is modifiable, some is non-modifiable. So let's focus on preventing what we can prevent, which is number one thing, UV rays. So exposure to UV rays, especially in countries that are hot and warm, like India, even in the UK, it's really, really important that you wear sun protection. That is the number. If there's one thing you're going to take away from this, that you do need to say that, because it's UV rays essentially, what they do is that they stimulate melanin, so the pigment in your skin actually increases its production when exposed to UV rays. And it's so important that to get on top of pigmentation, that you do need to protect your skin, and that's through the form of sunscreens, which I guess we'll talk about a little bit later in this in more detail. But I think in terms of prevention strategies, the most important thing I'd say is definitely wear a good SPF to protect your skin, and same thing as actually Palki said, try and avoid things like skin trauma, diet, especially things like melasma can be affected by diet. So hot and spicy foods, or even like when you're cooking, when you're leaning over like a hot pot, that's a lot of steam, that heat triggers melasma. So I think small things you can do to prevent your hyperpigmentation disorder from getting worse include slight modifications like that. And then I guess we will be talking about treatment strategies in a little bit, but I think that would be my number one recommendation, basically. Is there anything you'd want to add, Palki, to that?
I think one of the major things that you did mention was heat. A lot of people don't know that heat also causes melasma. So even if they are on a treatment, even if they are using an active ingredient for managing it, but a lot of women in Indian household, they cook themselves. So the heat, especially in summers, there is a lot of heat, and that can actually affect or worsen the melasma or any sort of pigmentation. So I would also recommend them that, of course, you can't stop cooking. So at least wear an SPF. Yeah, exactly. So just wear an SPF that time. So yeah, absolutely, I agree.
Just small measures. Yeah, like avoiding the heat, like sort of from late morning to midday, going outside, possibly using protective sunscreens, wearing large hats, but possibly not. I know scarves is a very big thing, but wearing something that can block out the heat completely. Very large hats could potentially make all of the difference when treating hyperpigmentation, I think.
It's all the tiny habits you
Yeah,
need to get
absolutely.
into to
Yeah.
protect your skin.
Just a little bit
Great
of
for aging
lifestyle
as well.
modification.
Yeah, exactly.
Yeah.
You want to, anti-age as well.
Yeah, so so just to add here, to everyone, our viewers, I would like to say that sun is a biggest factor of aging. So if you prevent sun, then that's the first step to your anti-aging. The next question is like, if someone comes to you, like a person who has developed proper pigmentation, what treatment options do they have?
So I think, like we've said, I think emphasized so far is the main thing is to firstly identify the cause. Diagnosis is to get the correct diagnosis is the first step, and then on you can treat it. And then I guess if we're talking in a more general term, then starting off with conservative management, and we've already covered sun protection, photo protection throughout 365 days of the year is absolutely key. Then, lifestyle modifications, like we said, diet, possibly installing sort of window screens that could filter out UV rays, things like that could help. And then I think if we're looking at sort of medical management, then we would sort of take a multi-pronged approach. So the key thing to identify is that hyperpigmentation can go on for a long time, and you may experience flare-ups. So with melasma as well, it's even if you treat it to its best and it goes completely, you can get a flare-up in 2 to 3 years. So for us, counselling our patients to say, we could do the best we can, and sometimes it might be disappointing for you, but this is a long-term condition, and you will have to take long-term precautions, and we may need to see you again in 2 to 3 years. So that's quite key. If we're looking at treatment options, then a multi-pronged approach, like I said, so using a mix of, the main thing is topical creams, and then we're looking at possibly chemical peels, which are sort of in-house clinic procedures, and then we're looking at lasers. So those are sort of the three main things that we can do for melasma, or main sorts of hyperpigmentation. So if we're looking at sort of creams, we would ask the patient to employ like a at-home routine where they get a mixture of creams, and there are loads of anti-pigment creams that we can get. Main things are, so we would use hydroquinone is a very important ingredient, like we know. So you can get hydroquinone creams or non-hydroquinone, and those are our two approaches depending on the patient. With skin of colour, hydroquinone needs to be used very, very, very carefully. So if we're talking non-hydroquinone, we're looking at things like vitamin C creams, then alpha-arbutin, kojic acid, also...
Is it licorice even?
Yeah, licorice extracts, botanicals like licorice extract, mulberry, and then vitamin A, so retinols. Those are our key ingredients that we're looking for. On the basis of hydroquinone, if we're looking at hydroquinone, then hydroquinone is a tyrosinase inhibitor, and then tyrosinase is essentially the enzyme that leads to the pigment formation or reaching the surface of the skin. And when you do get something like melasma, the cells that are producing the pigment sort of become extra hypersensitive, and that needs to be controlled. So we use something like hydroquinone, and whilst it's a very effective cream, it can be sometimes unfortunately misused by the industry. So we have to be very careful.
Yeah, absolutely, I agree. Because in India, I think a lot of people do use hydroquinone, and then there's a combination that everyone has used in their life, and I think they are still currently using. It comes with a combination of retinoid and steroids in it, along with hydroquinone. So 3 very potent agents all together. And usually these creams, they are named with, it is a heavy dose. So a very potent like mometasone, and mostly they use mometasone for this, which is a potent steroid again. And they do see results. Patients do see results, like maybe after a use of 15 or 20 days, they do see results that their pigmentation is gone. There might be a slight peeling because of retinoid, but what they don't get and they're not aware of is that the pigment will come back, and it will come back with the revenge, because this is not the right combination to treat any sort of pigment. And I think steroids, I think in UK, while they were teaching us, steroids was only prescription based, but here it is an over-the-counter medicine available. So I think there is a lot of misuse with this.
Definitely. I mean, I think here, like in over the counter at the pharmacies, you can buy steroid creams, but they're very low percentages. I think the maximum is up to 1%.
Yeah.
Anything stronger than that has to be prescribed by a doctor, because like you said, exactly, like they are very strong medications that you are treating your skin with, and they need to be prescribed by someone who understands exactly how to prescribe them. And because the side effects of them they're so wide ranging in steroids, you just have to be very, very careful to not like self-medicate with the wrong medication and fake pigmentation. For us, like you said, rebound pigmentation is a huge issue, and when it comes back that badly, it's going to be stubborn and hard.
Yeah,
to
absolutely.
treat. Yeah.
And I think, can you tell something about hydroquinone? Like, for how long do you prescribe it, or how long do you give it for? Because here, like for example, if I have to use it, I use it only for 2 months, and then I give a break. And the only problem is that here in India, we use somewhere around 2 to 4%. I think in UK population, like especially in Caucasians, we were using higher percentage. But I'm not very sure. Can you just talk a little bit about that also?
No, I think we are. I think because we're all aware of how strong hydroquinone can be, and it has to be used at a maximum of 4%. So in the UK, we do go up to 4%. Again, these are prescriptive medications, so they are given out only by doctors in the UK. And if we do prescribe it particularly for melasma or any particular pigmentation disorder, we do it rotationally, exactly like you said. So we do it probably maximum 5 months, I would say, that you are on it, and then you have to be slowly weaned off it, so that you can safely come off that medication. Then we taper you basically till you're off it, and then you have periods where you're off hydroquinone, and then if needed, your dermatologist can put you back on the next bout of hydroquinone, depending on how your pigmentation is doing. Like you said, I think it's a chronic condition. It's very long term. You're going to have waves of getting on top of it and controlling it well, and having waves of not. So that's exactly how hydroquinone is also prescribed, because we're just aware it is a strong medication. You can't take it for a continuous period of time. But that's just how we use it here, basically.
And since you mentioned that there are other treatment modalities as well, so I'd like to focus more on that. Like, there is availability of peels, and there's some really good lasers that do have very good benefits they show good results as well. So can you just talk a little bit about that and explain, like, how do they work, and what do people should go for topical management more, or they should combine the both together?
So I think it's so important to have a multi-pronged approach with this. So you can't just try one thing. Treating any kind of pigmentation disorder requires a couple of different tools, and obviously it will be different for every patient. So what one person gets a lot of benefit from, and another person might just need something else. So like you said, the peels, combinations of lasers.
It's not essentially a one-size-fits-all situation. So our determination of the treatment plan will be based solely upon the patient, and then I think ethnic background, skin type, skin thickness, all of that has a big part to play when deciding on the treatment plan. But if we are talking about chemical peels, then essentially with a chemical peel, you apply a mixture of sort of alpha hydroxy acids, that's sort of glycolic lactic acid, or retinol, and they can be quite superficial, they can be quite medium depth, and we do sort of either superficial or medium depth peels, and that will sort of take away the first layer of the skin, in very simplified terms, and take away the pigmentation with it. But with peels, you do need to be very careful, especially with skin of colour, and skin needs adequate prepping for possibly up to 3 months before you can even try a medium depth peel. So that's one thing to bear. And then with the lasers, there are a mixture of lasers that you can do, particularly for melasma. Q-switch from the Nd:YAG, the Q-switch mode of the Nd:YAG can be very beneficial, or pico lasers or nano lasers are very good for both melasma, but particularly post-inflammatory hyperpigmentation. So those are the kind of lasers that you're looking at. IPL can be good for sun damage and sort of solar lentigens and all of that. But if your diagnosis is wrong and you say your sunspots could be due to possibly early melasma, and 40% of patients who do have sunspots do go on to develop melasma. If the diagnosis is wrong there, then something like IPL, which is intense cold light and quite widely available amongst every beauty store or anything, then in every beauty salon, then it can possibly flare up your melasma versus making it better. So again, like we say, emphasizing on getting the diagnosis correct is possibly the most important thing.
I think just to add to the
I think
laser, it's just, I think we just have to be very, very careful with lasers. I think lasers are a great tool to be used, especially with our skin type and in, you know, with hyperpigmentation disorders. They do have a role in you know, treating, but they also, you have to be very, very careful. You have to, I think when you go to a laser practitioner, you just need to be very clear about exactly what laser you're using and how you're going to go about a treatment plan, because they are very strong, and you know, there is a very high risk of it actually making it worse. So I think just be very careful. There are options out there, but just proceed with caution.
Yeah, and laser for the purposes
of
laser for the purposes of hyperpigmentation or any skin conditions should only be administered by a qualified medical professional. So,
exactly. Yeah. I was just about to add this, because a lot of people don't know, and here in India the lasers have been kept by beauty salons. I think it was the same situation in UK as well, but there is a proper frequency, there's a proper energy, there is a wavelength that you have to be used in skin of color, especially Asian skin and Indian skin.
Definitely.
So yeah, so I think a person who has proper knowledge of skin, like you mentioned, skin thickness and how to use and what kind of frequency would be beneficial for skin of color, I think you should just get it treated from them and not from just any random person who has kept a laser, because it can flare up the melasma. So I think that's a very good advice. Sunscreen is one topic that has been avoided in Indian skincare. That is one thing I know. A lot of people, a lot of doctors, they generally do prescribe sunscreen, but people are not very, like, you know, they think that it is just an add-on step to skincare and they can completely skip it. So I want you guys to emphasize on it, or what is your take on using a sunscreen?
Yeah, so I think, as Palki correctly said, it can't be emphasized more than we are doing today. You know, it is very important that you use sunscreen every day. How these pigmentation disorders work is basically they overproduce this melanin, which is we talk about, which is the pigment. And one trigger for that is UV radiation. And you know, you might say, you know, I'm indoors, like, you know, I'm avoiding the sun, and you know, it's fine, but you know, UV rays do penetrate through windows. You can, on a cloudy day, even here in the UK when there's very little sun, on very cloudy days, you still have to be wearing sunscreen, because it's so important that you protect that top layer of skin, because as your melanocytes, so the cells that produce the melanin, they go into overdrive, they're very active, and they're to sunlight. They start producing more of this pigmentation, and that actually makes your hyperpigmentation worse. You know, and things like exfoliation things will remove that top layer, you know, so that you have new cells underneath, new melanocytes that, you know, haven't produced as much pigment. But your job is to make sure that new layer doesn't produce more melanin by protecting it with sunscreen. So, I mean, particularly in people of skin of color, we do have more reactive melanocytes. So you know, a little bit of sun can cause quite a lot of melanin to be produced from one cell. So it's doubly important that we of all people wear sunscreen. And in terms of the type of sunscreens, what we would suggest and what we suggest to patients in our clinic are using mineral and physical sunscreens. So things that have like titanium oxide or iron oxide, these are great. I mean, the only downside is sometimes you can get a bit of a white cast on skin of color, but in terms of the skin protection itself, it's great. You know, and then there are brands that are out there that, you know, don't really cause a white cast and things, and you know, you just need to find the right one for you, and that, you know, you're comfortable applying, and kind of just get into the routine of trying to wear sunscreen every day, because even through the day your sunscreen's going to start sweating. If you're wearing it under makeup or anything, like, you know, that is going to sweat off, and you know, you do need to be replenishing that every couple of hours, which, you know, I go in the middle of the day at work or, you know, out in the day, but you know, there's so many different formulations now. Carry it with you. Yeah, just sunscreen powders. There's, you know, great versions that you can kind of top up your sunscreen on. You know, definitely that's one thing you should be doing for your skin, you know.
Yeah, and then I think just to add to that is, you know, what with the type of sunscreens that we should be using, the most important thing to know is that conditions that cause hyperpigmentation, say melasma, have a very large action spectrum. So UV plays a very large role in it, correct, but so does visible light and infrared light. So making sure that your sunscreen is a broad spectrum sunscreen, which has all of these. And then, just like you said, wearing the correct quantity. So you're looking at 3 to 5 mils, which is almost a teaspoon of sunscreen in every application. You should be doing that at least 2 times a day. And then, like Vidya said, topping up regularly. But those are the key things to look at in a sunscreen. You know, broad spectrum, 3 to 5 mils, and wearing it twice a day, and you won't go wrong. With the brands, it's completely fine. You can wear something that is suitable for you and that you will wear. You know, brands is great, but then you shouldn't be focusing too much. If you're not going to use the brand that you bought and you spent all of this money on, then it's possibly not going to be such a good thing, is it?
Yeah, and here in India, we generally recommend using SPF 30 and above with a PA of, so 4 plus PA and SPF 30 and above. I think here in UK, there was availability of SPF 15 as well. But generally, here we recommend SPF 30.
But SPF, at least SPF 30, like you said. 30, that's something I should have mentioned as well. The SPF 30 plus. A lot of our sunscreens go up to about at least 50, and that's probably 30 to 50 is good coverage.
Yeah, 30 to 50, yes, definitely for Asian skin, 30 to 50. And when generally a lot of people do ask about the brand, so I only prescribe the medicated ones or semi-medicated, not the commercial brands, because there is a proper issue with quality. There is a quality issue generally with Indian products. So I think medicated sunscreens are the safe, because I think there was an article as well, and then there was a research done that a lot of sunscreens, if there's written SPF 30 outside, they only contain SPF 15. So there is no proper amount of SPF in a commercial product as there is in a medicated one. So at least those are more reliable.
Yes.
Definitely, yeah. I think in one aspect, I think that's how we differ as well, because we don't usually have, if you walk into a dermatology office, you can get sunscreen, but we don't particularly prescribe things like sunscreen. But that just comes down to the fact that we have so many regulations in terms of what can be on shelves and what products are sold to the public. So, that's interesting to know, actually. We do sometimes, we tell our customers, whatever's, if it's within your budget or whatever, if you're using something off the counter, that's okay with us. We have brands that we love and recommend to our clients. But either way, as long as you're using one, that's the important thing.
Right, absolutely. And lastly, I think we have covered up a lot of things. So lastly, if there is, just to summarize, if there is just one basic advice that you would give to a person who is prone to pigmentation or has melasma or any other sort of pigmentation, including freckles, what would that be?
I think everyone's going to get really sick of me saying, but sunscreen, and sunscreen. Just make sure you're wearing sunscreen day in, day out. I couldn't recommend it enough, because there is no point doing all of the main big treatments, spending a large sum of money it takes to get some of these conditions under control without doing some of the basics, and that can have the most effect, and especially in preventing further damage or causing in the progression of a disease. So I couldn't recommend sunscreen enough. And like we said, SPF 30 and above, 3 to 5 mils 2 times a day, and a broad spectrum SPF. Those are the take-home message from me personally. Yeah.
I completely agree. I think I definitely think that if you were going to take one thing away from this, I know we talked a lot about so many different topical therapies and choices that you can make. I think whatever you decide to do for your skin, just take it slow, take it low, because it's so important that you try. And if you're trying something at home, the most important thing is don't irritate your skin. If you find something is irritating your skin, you're going to make things worse. So, if you think there is something that's working for you, start using it slowly, consistently. If you are suffering from something that's probably a little bit more severe and possibly may need a dermatologist, then go see one. That's the most important thing, is like getting the right diagnosis. So you're on the right treatment plan. So I'd say that's the most important thing if you were going to take anything away from this.
Yeah, I absolutely agree. So going to a professional, a dermatologist, and using a sunscreen if you're not planning to go to one, or wearing a sunscreen and then going to a dermatologist would be a better
Yeah,
idea.
that's a combination. Do that.
Yeah. So actually, what I've noticed, so there's one more thing that I wanted to talk about was especially in people with skin of color, when you talk about pigmentation, so they kind of does have a psychological impact on them. It is just
Of
like
course.
basically being a brown skinned person, there is an issue. No matter what you say, you are comfortable with it, confident. But there is just that teeny weeny, I think it is in our genes, generally here in India as well. So there is an issue like people do comment on your skin, they do want you to become more fair. Then on top of that, having a pigmentation issue could be quite distressing for people. So,
Definitely.
what is, have you ever seen that in your practice or around you? Is there something that you want to add to it?
I mean, yeah, I mean, the the psychological impact of hyperpigmentation can be quite large. The burden is quite large, and but I think setting the patient's expectations into sort of counselling them that this is a long-term thing, and it will come under control eventually, but it will take some time, and sort of just counselling them through that, being with them, partnering up with them to sort of set a good and reasonable expectation, and working with them, and then you do end up that when things do get settled and things are treated and they start seeing positive results, then it can help them quite a lot. But yeah, on the aspect of colorism, essentially, I know it's an Asian thing, but it's not something that we at all would encourage in any way, and we wouldn't advocate that at all. But on the topic of hyperpigmentation, then yes, we have noticed that it can be, of course, it can be very distressing for patients.
Because a lot of time it is like they take a prescription from the doctor and they see a result on the pigmentation and then they use it all over the face because they think that if it can lighten this pigmentation, it can lighten their skin color, which I think is absolutely wrong. And like
Yeah.
we have already discussed about it, that a lot of these medicines are strong, they have strong ingredients, and there are side effects to them. So you should always use them with a prescription and under the vision of a doctor. And so I think we have covered up everything. And then there are a few questions that I got earlier today regarding this topic.
Yes.
And there are a few
For sure.
questions here as well. So why don't we just go through them?
Yeah.
So the first question I have is someone asked about pigmentation on my face, upper lip, and forehead and cheek. So what to do? This was one of the questions.
So hyperpigmentation on the face specifically, so periorally, so around the mouth, periorbitally around the eyes, very common in our skin tone basically. So I mean, it's anything you put on your face you have to be very careful about, which is we have talked about some strong ingredients, but I think combination therapies are great for this sort of thing. So for targeting specific areas, especially the face, chemical peels are great. Also, lasers also a brilliant option as well. But I think it will depend on the extent of the pigmentation and what is causing it, because that it always comes back to what is causing that pigmentation. Sun damage, do you need sunscreen? Is it post-inflammatory hyperpigmentation because you had acne on your face before and that's made it the reaction to that has caused the pigmentation. So once you've isolated what the cause is, then your treatment plan can be formed. So it will always revolve around that. But I think there's certain, if you kind of subscribe to the different modalities, once you know exactly what's causing the pigmentation, then that will be the best way forward.
And the best way to sort of identify is to make an appointment with an aesthetic doctor or a dermatologist and get to the bottom of it and get a treatment plan formulated by them.
Yeah, absolutely. And the second question is actually on acne only. So the patient here said that I get pimples which are fine, but the marks don't go. What to do? So for acne related pigmentation.
I think the best way of controlling post-inflammatory hyperpigmentation secondary to acne is to really get a good control of the active acne itself. So as soon as you start noticing acne pimples coming up, getting to the bottom of that, using the correct ingredients. And there are a lot of acne medications out there like benzoyl peroxide, sulfur, which have very great effects. And just getting to the bottom of the acne in the first 6 weeks, I think, is very key to determining how bad, and if you are prone to post-inflammatory hyperpigmentation, if you do get it, and how bad it may be, is sort of the answer lies on how well it is controlled in the initial phases.
Yeah, definitely.
Yeah,
Like,
absolutely.
acne is a huge topic and probably deserves its own IG live.
Yeah, yeah.
But I think the main thing to take away from that is if you can get control over active acne, whether that's through medication, whether that's through topicals, whether that's through different things. It's important that only when you can stop your active acne, so you stop having pimples, can you get control of the hyperpigmentation. So I'd say if for this person, definitely start focusing on therapies that can help with the active acne first. Yeah.
Yes, or using AHA or BHA in the form of a cream or a face wash. Yeah. That would take care of the acne and a little bit help to just exfoliate the skin and manage
mild acne and congestion really goes very well with chemical peels that have AHAs.
So the next question is that I have brownish spots on cheeks. I think she's talking about freckles. She says that they are not very visible, but only 2 to 3 of them are prominent. So what can she do for that?
I think freckles, it's a whole different ballgame. I think we did talk about this, it is due to exposure to sun. So, I mean, freckles are beautiful, if you've only got a couple, then I wouldn't recommend doing anything about it, like if it really, really bothers you, then, you could possibly, do a chemical peel or possibly use some light topicals. But, I'd say at the end of the day, if it's only a couple of spots, embrace it, freckles are beautiful. Like some pigmentation in the face is natural, freckles are natural. They are a result of sun exposure. If you don't want them to get any darker, then you can use sunscreen. But, if it's something that's, just a couple of spots are darker than the others and it's not really bothering you, then, I'd say just leave them. There isn't really anything you need to do about them.
And with freckles.
Absolutely, even I love freckles.
Yeah, if they are true freckles, in comparison to just sun damage, then even if you do treat them, the problem is that they always come back. It's just a matter of when it happens further down the line. But with like Vidya said, sun protection is just really key to stop further freckles from coming on.
And I think there's a filter with freckles as well. So people are using it. So of course everybody loves freckles. And I would also suggest to just leave it as it is. And then I think we got some questions here. Let me just thank you so much everybody for joining. And we have a lot of waves and hi and hearts. So I think there is one question about chloasma. That is, can you suggest a remedy to vanish pregnancy brown spots on the face that don't seem to be going after 6 years? So that's like a chronic pigmentation she developed post-pregnancy. So what can you suggest for that?
Again, make an appointment with an aesthetic doctor or an experienced dermatologist, and you have a range of therapies available to you. So we're talking topical creams, which are either vitamin C, alpha-arbutin. All of those are very efficient, ranging to chemical peels and then lasers, but they will depend on your individual skin type to determine the best treatment plan.
Yeah, definitely. Like you said, if it's 6 years post-pregnancy, then you are dealing with melasma. It is a stubborn pigmentation disorder, so you do need someone who can assess your skin properly and start you on the right therapy.
Perfect. I hope this answers your question. And then I have a hello from one of the doctors from Bangkok. Hello, Dr. To. Thank you so much for joining. Then we'll do one seminar with you as well. So then there's, can you suggest some good sunscreens for combination skin? We do have Avene here, so I think that was available in UK as well. Some of the very good brands from Europe are available in India. So if you want to talk about them, so if there are like few sunscreens that you can mention, I mean,
I mean, I think the main one we use in our clinic, which I'm sure you have there as well, is Heliocare.
Yeah, Heliocare,
yeah, it's a brilliant brand. I think it's specifically as well for skin of color because it is tinted, so you won't get the sort of white cast, and it's oil free. So even if you do have combination skin, you can. It's sort of a gel-like form. You can apply it without worrying about it making it more oily. If anything, you do get quite a matte finish with it, I think.
It's great for under makeup. for ladies. Sunscreen. I personally use it, and I wouldn't use any other sunscreen. And then there are a couple of very good other sunscreen brands. We use as brands by Zaino Baji, the Zio products, and their physical sunscreens are great, broad spectrum, like we said, SPF of 50, and those are very, very good.
So I think we have pretty much answered everything which was related to skin pigmentation. We do have some questions, but they don't fit the topic. If there is any question that anyone wants to ask personally, please DM me or DM at Beautox. There is a link of everything available, and if you have any specific questions for Dr. Vidya or Dr. Rishida or me, we would love to answer them. Yeah, I think we had a great session.
Yeah,
is there
it was
anything
so good talking to you. Yeah, thanks so much for inviting us to do the club.
It's been great.